According to data from PMA Survey 2020 carried out in 2017, the annual incidence rate of abortions in Nigeria was nearly 2 million abortions among women aged 15 to 45. 11% of women experienced complications for which they sought post-abortion care at the healthcare facilities. For many women, ending an unwanted pregnancy, the decision still equals death or serious injury. Generation Initiative for Women and Youth Network GIWYN is a non-profit organization incorporated in Nigeria in 2010. It has offices in Lagos and Imo State and 30 staff with skills as trainers. GIWYN addresses the unacceptable and completely preventable death and suffering of vulnerable women and girls due to unwanted pregnancy and unsafe abortion. GIWYN achieves this by identifying, capturing, and disseminating best practices and learning across countries to boost sexual and reproductive health and rights advocacy effectiveness amongst partners. Coalition building with Nigerian sexual and reproductive health and rights organizations, and leading a hotline strategy focusing on sexual and reproductive health and rights, especially abortion rights. To end unsafe abortion, GIWYN builds and supports the National Coalition for Reproductive Justice, which was created in 2014 with 8 organizations and has grown to 52 organizations in 2021, including 45 organizations from Nigeria and 8 organizations from Cameroon, focusing on medical abortion with a human rights framework. 98% of these organizations have integrated reproductive rights into their work. The coalition is made up of activists, midwives, community health providers, lawyers, politicians, and community-based organizations. The geographical scope covers Nigeria and Cameroon. In Nigeria, it covers 5 states, which are Cross River, Imo, Edo, Lagos, and Ogun State. The National Coalition engages in a range of harm reduction strategies, including convening workshops and trainings of trainers for activists nationally and across countries on medical abortion protocols, supporting campaigns that raise awareness on where and how to obtain contraception, emergency contraception, safe care, and post-abortion information and services, and to end misconceptions and stigma, including expanding broad sexual reproductive health and rights, especially for safe abortion. Participating in consultative meetings to adapt the national guidelines for the safe termination of pregnancy within the legal context in Lagos State. Conducting advocacy meetings with local politicians and policymakers. Connecting to opinion leaders, the media, and the stakeholders such as traditional leaders, civil society organizations, executives, media editors, politicians, and local decision makers through publications, press releases, and open letters to identify champions of reproductive health who can help prevent unnecessary harm to women's health. GIWYN manages a sexual and reproductive health hotline called Miss Rosie Hotline. This multilingual hotline is an automatic information system available in 3 languages: English, Igbo, and Yoruba. Miss Rosie Hotline assists poor and vulnerable women and girls with reliable information on options when faced with unwanted pregnancy, modern contraceptives, missed miscarriage, post-abortion care, safe birth, and prevention of postpartum hemorrhage with misoprostol. With the life-saving information, women and girls navigate their health literacy and self-empowerment. It puts power and decision into the hands of women by giving them accurate, scientific, and reliable information about women's reproductive health and safe choices. Since the establishment of the toll-free hotline in 2016, funded by AmplifyChange Strengthening Grant, it has received almost 3 million calls. The high volume of calls is because of the increase in community activists, pharmacies, and midwives who work voluntarily to ensure that people make timely and effective use of the hotline service. These community networks raise awareness and talk to others in the community about the hotline through workshops, training, mentoring, and exchange visits. The hotline has proved to be an indispensable service and tool for women's self-care and safe choice, even during the COVID pandemic period. In a piece of research conducted with IBIS Reproductive Health, examining women's experiences with hotlines, women reported having a good experience receiving services from the helpline.
This is a place where you can first find understanding, secondly, an individual approach to your case.
What they said didn't make me feel like a criminal.
It was very professional, and that made me feel safe and not guilty.
We have increased accessibility of the hotline by upgrading to a cloud server app to enhance the reach of the interactive voice response technology. Information about Miss Rosie Hotline is shared through active media and smaller community trainings. The implementation of innovative, bold programs such as safe reproductive health hotlines have potentials to inspire others and encourage partnership, especially in Africa. Hotline models such as Miss Rosie Hotline have supported newer hotlines through knowledge sharing, capacity building, and mentoring. 10 organizations from 5 Western, Central, and Eastern African countries have been supported by investing in technological innovation to increase access to sexual reproductive health information. In 2021, we supported the launch of a new hotline in Abuja, Nigeria, through the AmplifyChange network grant. Unsafe abortion affects the most marginalized, including gender minorities and those who face educational and income disparities.
Doing abortion wrongly can lead to deaths. When women have access to this information, they will have autonomy over their bodies.
Women need information about their sexual and reproductive health into achieving gender equality.
GIWYN's goals over the next few years will include building a more inclusive reproductive health and rights movement for all, including the most vulnerable and the sexual minority groups. Supporting the coalition to continue to expand its geographical scope to 10 states to increase the number of grassroots organizations and beneficiaries to support their capacity and capabilities to end unsafe abortion. Investing in technological innovations like hotlines, websites, blogs to increase access to medical abortions in communities in the region. Ensuring accurate sexuality education and sexual and reproductive health and rights information and services, including safe abortion, are available and accessible to all. Ensuring women, girls, and all are empowered with accurate information to exercise the right to bodily autonomy and empowerment in a violence-free environment. However, under a restrictive legal and social environment, with the COVID-19 pandemic limiting the complicating sexual reproductive health and services, as well as facing a shrinking fund space, poses a barrier to carrying out our work. GIWYN needs support to navigate this opportunity in order to expand access across the country and in the region.
Funding sexual and reproductive health and reproductive rights work, including abortion rights work, will help save women's lives, as well as improve their health and well-being.
Generation Initiative for Women and Youth Network and the National Coalition for Reproductive Justice are committed to working on these important women's rights issues. Access to safe abortion will help achieve health equality among different population groups and prevent unnecessary harm to women's health and lives.